Thank you very much, Brian. Very, very inspirational as usual. Actually, Brian and I have been having a number of conversations over the last couple of weeks, just exploring how Brian's organisation can help Connected Health Cities. And I firmly believe there's going to be real opportunity there. I can't quite articulate it all just yet, but I'm absolutely confident about it. And actually, the closing point there was a good segue into the conversation. I'm going to just spend 10 minutes giving you a very brief overview of Connected Health Cities for the Northwest Coast. Some speakers, Hakeem and John, who are going to follow me, will give you much more detail about the programme as a whole. I've been very excited about Connected Health Cities right from the outset. And like Brian, I've been thinking about other things that happen digitally. And I pulled some slides out. It doesn't really matter because you probably can't read them, but we all know about the exponential growth in digital solutions in other sectors. And there's been a programme on Radio 4 called The Digital Human. I don't know if anybody's actually listened to it, but it's an interesting programme. Well, I think it is anyway. And I was telling a story a few weeks ago about why I've started looking and exploring this. I'm selling my house, and when we bought this house 10 years ago, I didn't realise we didn't own the garden. And to change that, I had to, you'd think you'd know, wouldn't you? Obviously, that was a very difficult conversation with the solicitor about how she'd not managed to notice this. Anyway, long story short, I had to go back to the land registry, and I had to write a cheque. And I couldn't find my bloody chequebook anywhere, and then I did find it, and the last time I wrote a cheque was in 2004. Just kind of emphasises this digital world around us. And actually, it crosses all spans our whole life, including death. Now, this is an interesting idea. I'll pass this slide. Has anybody seen anything like this before? This is a robotic avatar. Now, what I found really interesting, there is a thread into Connected Health Cities, I hasten to add here. This was built by this chap in the background, it's blurred out. But you can ask this robot questions and it responds back. Her name's Bina, and she has died. And what they're working on is an algorithm that takes your digital footprint and creates an artificial kind of being. It's not a resemblance of you after life. And then it made me think about all the things we do now. There's a lot of services out there that take your Facebook and other social media and create a digital archive for you on death. And this just goes to show where we are. The other thing, so this kind of chain of thought goes along, and then I started looking at internet ranking. It's, sad life that I lead, but internet ranking. So where do you think NHS.uk comes in the kind of ranking on internet websites? Bearing in mind, it's probably, we're the biggest employer, I think, or third biggest in the world, something like that. Do you think it's in the top 100? Who thinks it's in the top 100? Who thinks it's in the top 1,000? Top 10,000? Top 100,000? It's 185,500th in the world rankings for internet searches. So it gives you an idea about where we are in terms of digital enablement. But what is interesting about this story, bearing in mind where we are, is how they're using data. And they're using data in ways that we probably could never have predicted a few years ago. And I think that kind of emphasises where we're going with Connected Health Cities. I don't think we have the answers today, but I do know we've got the expertise in this room to find out all new insights, to create this concept of a learning healthcare system. So what have we been doing in the Northwest Coast? We've assembled some tremendous expertise and capabilities, and this is just the start of our story. You're going to hear today, the reason you've got these kind of speakers and the structure of today resembles this diagram. So you're going to hear from colleagues from Liverpool University about the therapeutic themes. We're going to hear from Lancaster University about how we can create capability, skills within the workforce, bring together our combined assets and use them to deliver this concept of a learning health system. We've got industry. We've got representatives from AIMS, and it isn't just AIMS. I really hasten to add to this. This programme is about improving health outcomes, but it's also about driving economic growth in our system, in our country, in the north of England specifically. And Hakeem has led the challenge back to the government to get funding for this programme. And I believe this is the start of something particularly exciting. I'm already seeing it in the way that some of our colleagues in the room who have been working with me in the last few months are driving this agenda forward. So hopefully today you'll get a chance to learn a little bit more, but more importantly, and this goes for everyone, supplier, clinician, whatever your business is, we want you to help us co-create. This is about the Northwest Coast together, driving improvements in health and economic growth. At this point, I'd like to hand you over to Akeem Yadi, who is I'll leave him to introduce himself actually, rather than fluff it.